This Cincy Lifestyle Health segment, sponsored by Mercy Health.
From respiratory conditions like asthma and bronchitis to COPD, emphysema, cystic fibrosis, even lung cancer, pulmonologists specialize in treating your lungs. Dr. Dan Murphy, critical care pulmonologist at Mercy Health Kings Mills Hospital, shows us how these specialists can help you breathe a little easier.
I'm Dr. Daniel Murphy. I'm a pulmonary and critical care doctor, chief of staff up here at Kings Mills Hospital. So I do two things. I do pulmonary and critical care, so that's lungs and life support. Patients who have breathing problems will come and see us about things on the outpatient side. Asthma, COPD. COPD is probably the most common lung ailment. We also see interstitial lung disease. We do a lot with pulmonary nodules, lung masses, things like that. Lung cancer screenings, things of that nature. Lung disease can be fairly insidious. The fact that you can sit and not be short of breath, but then you try to run and you can't go as far as you want. Some of that can be conditioning, but some of it could be lung disease. When patients start having shortness of breath doing things that they would otherwise not have gotten short of breath doing, that's usually when they start getting concerned, and can be something that we could evaluate to see if we can find a problem that we could treat. So for COPD, the first and most important thing is to quit smoking. Beyond that, there are things like pulmonary rehab, which is a physical therapy program for patients with chronic lung disease. There's inhalers, there's other behavior modification things. So we use pulmonary rehab for patients who've got newly diagnosed interstitial lung disease, moderate to severe, even very severe COPD, especially after a flare, to try to get them basically functioning better with the lungs they've got. The C in COPD stands for chronic, so it's not that we can cure it, but we can help minimize symptoms. So if we can't make your lungs better, something like that helps you work better with the lungs you've got. Here at Kings Mills, we actually have a wide variety of specialty and subspecialty treatments. So pulmonary and critical care being one. We also have cardiology, infectious disease, nephrology, your real main internal medicine type specialties. And so we all collaborate to try to find the best care for the patients. And actually, one of the challenges of opening a new facility is making the citizens in the area aware that we're not just a standalone ER. Because we do have emergency services, of course, but if somebody needs to be admitted to the hospital, the vast majority of the things that they would need, we can do right here. And I really like fixing things. And I see patients that are ill, and often, especially if they're short of breath, they're pretty scared. So being able to ease that is important to me. That's the thing that I find the most enjoyment out of. And also, I just like talking to patients and getting to know people, and I tend to use a lot of humor in my care. It gives me an idea. If somebody doesn't laugh at my jokes, they must not feel very good. For overall lung health, again, quitting smoking is the most important thing. In addition, our patients who do smoke, lung cancer screening for patients between the ages of 50 and 80 can be very helpful in trying to identify early lung cancers. Those are all very important things that we talk about every day. If you do have allergy triggers, avoiding those things or getting evaluated by an allergist may be helpful. And then cardiovascular fitness. I mean, you can't say enough for physical activity and trying to be in as good a shape as you can be. None of us are perfect, myself included. But yeah, those are the main things, is trying to keep your cardiovascular fitness as healthy as possible.